Hello guys, welcome back. Let's continue with our nursing topic. In this video, we'll discuss persistent pain, often known as chronic pain. Now we know that pain is 100% created by the brain and is a universal human experience. This encompasses any forms of pain, no matter how long or short it has lasted. Persistent pain occurs when pain lasts 3 months or more and does not respond to traditional medical therapy. In such instances, the suffering provides no purpose or use. Acute pain is the brain's response to tissue damage or potential injury, but chronic pain is not. So, why does the brain continue to produce pain even after the bodily tissue has already been restored or healed? Chronic pain from various causes has been labeled a disease that affects brain structure and function. These anatomical changes can be explained by neuroplasticity, or to put in another way, neuroplasticity in the dorsal horn of the spinal cord is one of the reasons for this. Pain becomes persistent or chronic as a result of changes in neuronal anatomy and function. What we see here is an afferent nerve fiber that transports impulses to the spinal cord and terminates at the synapse. Then there are the secondary neurons that receive the impulses, and this is located in the dorsal horn of the spinal cord. Okay? In our last video, when a pain receptor is activated and relayed to the spinal cord by the afferent neuron, neurotransmitters are released into the presynaptic gap and diffuse over the synaptic gap, stimulating the postsynaptic membrane and sending information up to the brain. And then after that, the brain will give the sensation of pain. Neurotransmitters must diffuse from the presynaptic membrane to reach the postsynaptic membrane. Do you recall the diffusion process? The transfer of chemical from a high concentration area to a low concentration area. That is the simple diffusion. When there are a lot of neurotransmitters in the presynaptic gap, especially when there are more painful signals, they diffuse and reach the postsynaptic gap. This also implies that the neurotransmitters will also diffuse out of the synaptic gap, especially if there is a lot of pain going through. This is where the problem began. In addition to neurons, there is another type of cell in the central nervous system called the glial cell. Glial cells are non-neuronal cells found in the central nervous system and the peripheral nervous system that do not produce electrical impulses. What they do, they maintain homeostasis, create myelin in the peripheral nervous system, and nourish and protect neurons. So they are this sort of supportive cells type. When this type of cell is exposed to a neurotransmitter, it can activate genes in glial cells. When this occurs, these genes release chemicals from the glial cells. This substance is a kind of cytokine, and it communicates with the afferent fibers of the pain pathway, stimulating additional neurotransmitters release and causing greater pain. As a result, the glial cells' chemical discharge is bothersome. They are really bothersome. At the same time, the increased release of the neurotransmitters produces more DNA activation in the glial cells, causing the glial cells to produce more chemicals. So, what will happen after that? This phenomenon create a loop, a terrible feedback loop, okay? So, do you get the picture? The pain is now coming from the nervous system, specifically the spinal cord, rather than from the tissue injury. Alright? So that is the beginning of the chronic pain. As far as I know, there is no particular treatment for this at the moment. However, we can manage it by administering local and systemic analgesics. maybe cognitive behavior therapy, psychiatric counseling, and maybe the best way is to aggressively treat your acute pain to avoid this vicious loop from occurring.